Okay. So we've got Club. This is Connor Club. He has Crohn's. Okay. He's a post-bowel resection. And he ended up getting a colostomy. So, he had a colostomy revision. So he needs help with that and just getting that Crohn's under control a little bit more. Okay, all that. And finally, Donald Diamond. He is here. So he has aspiration pneumonia for ALS. Okay. This is his third time with aspiration pneumonia, and so he's struggling a bit. He has a trach to maintain his airway, and he's got a peg tube now so that they can feed him. Okay, so these are your 4 patients. You've got Heather Hart, who is from a back surgery but does have a kidney transplant. You've got Sally Spade, who's an MS flare-up, and so she just needs to rebuild her strength and get some her steroids used. You've got Connor Club, who has Crohn's. That's a lot of C's in a row, and he's here for post-bowel resection with a colostomy. And then you have Donald Diamond, that's an ALS patient with aspiration pneumonia, trach, and peg. So what I want you to do is show me the card of the patient that you're going to see first. So which one of these patients are you going to go see first? Okay, so I have Diamond. I see Diamond. Okay.
Can I put towels up?
No.
I would choose Diamond, sorry.
Here's Diamond, okay. So I see Diamond's kind of winning out. Donald Diamond.
I'm going Diamonds. I just don't have a pen and paper at the moment.
Okay. You guys are gonna have notes from this. Oh, Christine, I like your background. So, all right. Oh, so she's got Diamond. Okay. So it looks like
Karen.
Huh?
I'm gonna go with Diamond too. I just don't have paper and pen.
Okay.
I see a spade up there at one point.
There's Spade. Oh, yep.
Tanisha said spade.
Go see that MS flare up. Okay. Let's see how they're doing. All right. So what we're going to do now is, this is where my assistant comes in. Okay. So first, Raya. All right. So you guys know I'm not cheating. All right. Pick a card, any card. Okay. So we got 2. So that means we've got 2 pieces of information that we're going to get for our patient. All right. Okay, one more. All right, so the 2 pieces of information we got the meds for Diamond. Okay. The meds for Diamond. He is on IV antibiotic for 45 days via PICC line. He also gets Mucinex 3 times a day, albuterol PRN, and he gets prednisone BID. Okay, so Donald Diamond gets some meds here. He gets IV antibiotics for 45 days through a PICC line. He has Mucinex 3 times a day, albuterol PRN for shortness of breath, prednisone BID. All right, that's Donald Diamond, and then we have Heather Hart. Okay, then we have Heather Hart, and we got her lab results. So she has of 8.9 with an 18 for her hematocrit. Okay. She has a creatinine. Is that right? Yeah. Yeah, creatinine is 6. Oh yeah, that's right. Sorry, my brain's getting mixed up already. I'm getting my patients mixed up. Creatinine of 6, a BUN of 62, a potassium of 5.8, and a sodium of 138. Okay. So we've got Donald Diamond, we've got his meds, IV antibiotics, Mucinex, albuterol, and Pred. Heather Hart, we've got a hemoglobin of 8.9 with a hematocrit of 18, a creatinine of 6, a BUN of 62, a potassium of 5.8, and a sodium of 138. So now hold up your cards and think, does that change who you're gonna go? Does that change your order of who you're gonna go see? So think about, who are you gonna go see first? Any of these guys? Hold up your card. Which one are you gonna go see first? Okay, gonna go see Club first. Heart. Okay. I see Heart for Jen. Heart for Miranda. Heart for Tanisha. Okay. I don't know who this is, so we'll see if they're friend or foe.
I'll choose heart.
Heart clubs. Okay. What makes you guys, so I see a lot of people going to see Heart. What makes people want to go see Heart?
The hemoglobin.
Okay, we got a low hemoglobin. What else is kind of concerning about that Heart?
What's the creatinine?
Creatinine is 6. What should your creatinine be?
That's too high, Erin, isn't it?
Well, it is high. That is true. Too high is a judgment call, but it is definitely a high creatinine. Okay. All right. Okay.
Isn't the BUN really high?
Yeah, that BUN's really high. What's that telling you?
Her kidneys aren't working.
Yeah, we got something going on. We know that she's already had kidney issues, so we definitely have something going on with that kidney in her. Okay. All right, let's go. Raya, come draw a card. All right, draw a card. You just look like this floating hand, by the way. Oh, too. She's really bad picker for you guys. I'm sorry.
You're welcome.
All right. Go for some ones that are bigger. Okay. Okay, let's do that one first. So I'll talk about it. So Spade. So Spade, we got vital signs. No, that's blue.
Another one.
Okay. So Spade, we've got vital signs. 97.1 temp, 92 over 45, 99% on room air, and Respers of 14. So nothing totally earth shattering. Okay, that one. Oh, Donald Diamond. He's green, he's purple. Okay, so Donald Diamond has some family that are causing us some frustration. So this is going to be our assessment for him. So Donald Diamond, he sneaks sips of water. Because his family gets it for him, because he's wheelchair bound, so he can't get them. So he gets sips of water. He's wheelchair bound. He has gross He only has gross motor movement. He's lost the ability to move his extremities. His lungs, they're clear on the left, but they have crackles on the right. He's got 2+ edema in all extremities. His heart is muffled and his pulses are weak. Okay, so we got some additional vital signs, and then for Donald Diamond, we got his assessment of kind of where he is in the scheme of things, right? So he's sneaking those sips of water because his family thinks he likes them, so they're going to get.
Erin, is he on an antibiotic?
Huh?
Is
Yeah.
he on an antibiotic?
Yep, he's on an antibiotic for 45 days. So wheelchair bound. He's got some gross motor movement, but really not much. And then we've got clear in the left, crackles in the right. Edema, muffled. Okay. Does that change who you're going to go see first? Claire, Catherine, you're not helping me right now. Does that change who you're going to go see first? So hold up your cards. Who are you going to go see first? Cards, shapes, whatever you got. Okay, so we're back to, we got Diamond coming in again. Okay, gonna go see Heart. Don't want to see first. Don't want to see Heart first. Okay. Okay, Heart. All right. So it looks like still kind of between Diamond and Heart. Who's saying?
Diamond.
Diamond. Okay. What's making you guys want to go see Diamond?
Her kidney's not working.
Kidneys is Heart.
Huh?
Heart is the kidneys.
Oh, my bad. Sorry.
So you want to go see Heart?
I do.
Okay.
I help Heart.
Okay. Like to see Heather Hart, see how that, we got some kidney issues going on.
Mm-hmm.
Okay. All right. Let's see if our assistant can pull out a bigger card than, you guys may have been luckier with me pulling cards.
Come on, Raya.
Big numbers, no whammies.
10.
10, there we go. That'll get us some more info. All right. Now we got to keep count. Okay. All right. So Diamond, more Diamond, man. We're just rocking out on Diamond here. So Diamond, so these are our orders for Diamond. He gets bolus. So he gets bolus feeding. He's not tolerating them. Okay. We're getting a lot of residuals back. He uses a speech board. He uses a speech board, and he is a strict NPO that his family is not following. Okay, so that's some assessment data. So that's one piece. Okay, if you're gonna do this, you gotta just stay here and chill. I promise you it won't be that bad. All right. Oh, so here's the other part of Diamond. He is 52 years old, and he is a full code. Okay, all right. Spade, no, that's club. That's club. You don't even know your suits.
I don't.
That's
Can
not.
you repeat what you just said?
For so for Donald Diamond, he's a full code and he is 52 years old.
Thank you.
And then club. So now we're going back to club. So this is our assessment on club. He is. We're looking at his stoma. His stoma is protruding. Okay, it's dusky and moist. And the peristomal skin is really pink and painful. Okay, it's draining a lot. So we're having to empty it frequently. He's got hypoactive bowel sounds ×4. And let's see, he's alert and oriented, strong and equal, and his lungs are clear throughout. So the rest of his assessment's pretty benign, but we do have some issues going on with that. That stoma's protruding, and it's a brand new stoma or revision. We've got hypoactive bowel sounds, dusky and moist, and he's got some issues there. All right, so heart. What color is heart? Blue. Where'd my blue go? Thank you. Yep. All right. So blue, we have her medications. So she is on Prograf, Cellcept, and prednisone. So heart is on Prograf, Cellcept, and prednisone. I think my assistant wants to play with a cat. Okay. Club. We have Club's vital signs. So 97/8, 132 over 8, 56 for a pulse, 97% on room air, and respiratory are 16. So nothing uber horrible there. Okay.
Erin, what was the blood pressure?
Blood pressure is 132 over 88.
Thank you.
You're welcome. And definitely, guys, my board's going to get real messy real quick here because it's not as big as the boards at school. So make sure if you have a question, make sure you ask. So, okay, heart. Well, this is shocking. Heart's not feeling well. She's not feeling well. She's like really weak and sleepy. She's got crackles in her lungs throughout, and they're diminished. Her pulses are bounding. And I mean, she's got like 3+ edema in legs. Let's see.
Yeah, because the kidneys aren't working.
Right? She's pale. Well, remember, she's a kidney transplant, so she doesn't have both kidneys anyways. And she is, I mean, when you can wake her up, she's alert and oriented ×4. So she knows, she's able to answer questions for you. All right, how many we got here? 1, 2, 3, 4, 5, 6, 4 more. All right, no whammies. You guys are probably, a lot of you are too young for no whammies. All right. No whammies, big numbers, no whammies. All right. Yeah, see. Club, we've got a white blood cell count of 8, hemoglobin of 15 with a creatinine of 45, sodium 132, potassium is 3.4, BUN is 8, and creatinine is 0.9. Okay. You need any of those labs repeated? Give you guys a second, catch up. So for club, we have a white blood cell count of 8, hemoglobin of 15 with a creatinine of 45, sodium of 132, potassium of 3.4, BUN of 8, and creatinine of 0.9. Man, Spade's just hanging out there, not really giving us much today.
So you said creatinine twice, right? For that one?
Well, it's 0.9.
Okay.
So there's hematocrit and creatinine.
Wait, is there any of that?
All right. Sorry. I think I just misheard you. I'm sorry.
Yeah, no, you're
So
good.
what was the hematocrit?
The hematocrit was 45.
Okay.
So, okay. And then we got clubs, green. I should have put colors on here so I know. Medication, really, he just gets Remicade every 3 weeks. And otherwise, he's just on like basic meds and, you know, typical rehab meds, maybe some pain meds, Norco. Okay. We're getting down. The bowl's getting emptier.
Agree.
Okay?
Yeah.
Club? All right. So our orders for club, see how much my board shows. Our orders for club are a weekly pouch and wafer change, and then INO. So we need to make sure we're watching that INO. Okay? How many was that, Raya? 1, 2, 3, 4, 5, 6, 7, 8, 9. One more. All right, heart. So heart, we have vital signs. So 99.8, 178 over 95, 110, 98% on room air, and 18 respirators. All right, so now, knowing that's where you're at, have you guys kind of rethink? Who are you gonna go see first? Grab my coffee, please. You can think about it for a little bit, don't. This one is take some time to ponder.
I'm gonna go get my tea.
I'm gonna see if I can do some breakout rooms. Okay, and real quick, guys, I'm gonna just try this because I want you guys to kind of talk to each other. We're gonna try breakout rooms for about 5 minutes. So it's 9:30, so at 9:35, we'll kind of all come back together. So let's see, I'm gonna open all rooms and see what that does for you guys. So can you guys go to your rooms? Can you see them? Jen, are you still there?
Hmm?
Can you see where it says go to your breakout room?
Yeah, with Christine and
Yeah,
Casey.
yep, go ahead and go.
Yeah, I'm in here. I just don't know what happened to my camera.
Okay, see, so we can join breakout room.
Try it.
Ha, I can pop into rooms.
Oh, Erin's here.
See, don't talk bad about the teacher. I can pop in and out of rooms, so. All right, who would you guys see? Who would you see first?
I think I would still see Diamond.
Okay, well,
I'm kind of stuck between Heart and Diamond. So
if you were to say right now that you're gonna call the doctor for one of these, say that we got down to the 2, what are you gonna call the doctor for? What are
Heart.
you thinking? What do you think? What are you, because the nurses we have to anticipate. So what are we anticipating that these 2 patients need? think about that. What are you anticipating that you're calling the doctor for? And which doctor do you call first? I'll let you guys think and ponder on it. Pops in and out. Okay, so I want to go to a different. Where are my breakout rooms now? Dang it. See, I'm still learning all this. Enter full screen. Here it is. Breakout room. I'm going to join a different one. Okay, I'm going to leave the one with Amy alone. I'm going to join that one.
No.
I love that. I was like, I have to use my blanket because I don't have any pants on. Boom.
Welcome back, Aaron.
Which of these patients are you guys going to go see first?
We just have like one dilemma.
Okay, what's your dilemma?
So, well, I do. That I told them about. It's like, so we want to know like what the IV sites look like.
Okay.
And then the other thing, because like you can check on the IV site and then like go to the next room like in 2 seconds.
Right.
But then like Christina brought up like Heather's like failing kidney versus Connor's like bowel resection not going the best. And we just like talked about like she's not gonna just be able to just get another kidney ASAP. She's gonna, but the other guy, he might be able to like go into surgery and get a little bit more of his bowel resected.
Yeah, absolutely. So here's the question that I'm trying to ponder for you guys as I'm popping into your rooms. Think about, you need to call the doctor, right? Because we can't do anything with all this right now. We need to call the doctor. So who are you going to call the doctor on first? And what order or what are you wanting to get from that doctor? All right, so I'll give you that and I'll go pop into another room.
Yeah, you can.
Well, that means everyone's in the room.
I'm leaving the one that has Amy in it because she's free. Yeah.
I don't know which other one they said that was bad, but that's why I'm choosing her. But otherwise, I would want to know like diamonds, vital signs.
So here's my question for you guys. As you're going through these, as the nurse, you've got to call the doctor. Like, you can't do anything about any of this stuff until you call the doctor. So whose doctor are you calling first? And what order or what are you looking for to get from them? What are you anticipating for an order or something that you want from them?
So for hearts, maybe trying to see if we can get some Lasix going.
Okay. Good. Definitely could get that volume.
See if that would help improve her status a little bit.
Okay. Definitely a possibility. What else? If her kidneys aren't working, where do you want her to go?
Oh, dialysis?
Yeah, maybe we need to get her to transferred to dialysis. You know, I mean, maybe we could try Lasix and see, like, is her kidney just shocked because of surgery and it's just taking her time, or is that kidney failing because it's starting to reject? So it's like, what's going on? Right? Remember, this is an immunity lecture, so we have to go into some of the immunity stuff. So think about that. I'll let you guys think about each one of these. What order? So you're going to end up calling the doctor for all of these patients. What order are you anticipating that you want? You know, think about that, and I'll go hop into another group.
Aaron's back.
I am back. I went to main meeting, and apparently it gave me this.
Well, you said come back at 9:35, so we came back.
Holy cow. Yeah. Can I make everybody come back now?
I don't know.
Yeah. Every time it pops me back. Close all rooms. So this should put everybody back. Breakout rooms will close in 60 seconds. Okay.
Oh,
Interesting. I'm learning, guys. I'm learning the tech with you. So, woohoo! Got people back.
woo! Hello.
We're getting victories today, man. Small victories. Okay. You guys have done lots of talking. There's mine. Okay. I definitely need to clean my lab here. So, all right. Okay, Raya. We're gonna do one more round here and we'll see where we're at. 6. That's pretty good. Better than 2. I don't think the class was liking you a whole lot with a lot of those 2s. All right.
Finally got that blue.
Dark blue? Okay, so spade. We have lab results for spade. We've got white blood cells of 12, hemoglobin of 99, crit 48%. Our sodium is 148. Potassium is 5.1. BUN is 12. Gatlin is 0.8.
Can you repeat that?
Yeah. Just a second. I'm gonna see how I can mute all. Should I mute all?
Mute all right there.
Okay. Can you guys hear me now? Okay. Thumbs up. All right. So we have a white blood cell count of 12, and this is all for Spade. So Sally Spade, right? Yeah. Okay. 9 hemoglobin of 99 with a hematocrit of 48%, a sodium of 148, a potassium of 5.1, BUN of 12, and a creatinine of 0.8. So we've got some things that are a little high. All right, so that was 1. Oh, I better put it up here so I don't. Okay. Okay. Heart. What's this one? Okay. So for heart, these are her orders for the heart. PT, OT daily. Spine precautions. And then renal diet. So she's kind of a true rehab patient right there. All right. I got one of the bigger ones. Size-wise. There we go. That's not big. All right, Spade.
I'm sorry, Erin, can I just ask one question?
Go for it.
Because I missed this about heart. All right,
Yeah.
I'm sorry. Yeah, about heart. Is she in there for back surgery or did she just have a kidney transplant?
She is in for back surgery. She has a history of kidney transplant.
Okay, thanks.
Yep. So Spade, any other questions? We're good? Okay. So Spade, no, that's the wrong color. I don't want to mess up colors, otherwise that'll mess me up worse. Spade, PT, OT, and then her diet is normal. She is on a regular diet. Okay. I'm trumping you, I'm picking that one.
Oh, come on.
So let's get Spade's assessment in here. So we've got crackles throughout. Right. Yeah. Crackles throughout. Pulses are palpable. No edema. Alert and oriented most of the time. Some weakness to legs, but it's equal. Okay. her arms are strong and equal. Her arms. Ooh, it's gonna get crazy. She did, however, only have 80 mLs of urine out in the last 12 hours, and she won't drink much because it makes her cough. So,
Erin,
yeah.
she doesn't have IV or peg tube.
Not in this assessment, she doesn't, but those are good questions to make sure to ask.
Okay.
Okay, and then let's see, I'm gonna go. So here gives us a little bit more information on her. Here's her medications that she's on. So we talked about that she's finishing out her steroids in the very beginning. She gets Solumedrol Q8 hours via port. So she has a port access. And then she gets a Tysabre infusion. Oh, Benny. Sorry, my cat just knocked everything over. Cat. And there's no door, so I can't shut her out. That's our problem. But anyway, sorry. Tysabre infusion Q28 days. So she gets it's Tysabre as a, make sure you kind of are looking up some of those medications. And then let's see. I am totally cheating now.
Rude.
I know. Oh, I won't, because none of them are. Yeah. Okay, so we've got port, Solumedrol, and then we've got the low, again, I'm losing space, low urine output. Okay. All right, so for Diamond, purple. So Diamond, we finally got some lab results back. Man, those took forever. Okay, we've got a hemoglobin of 13 with a hematocrit of 36, a white blood cell count of 15.3, potassium of 3.5, sodium 136, and he did have a chest x-ray, and it showed infiltrates bilaterally. Okay, or no, never mind. Infiltrates on the right, sorry. He's not bilateral. All right, so that was our 6. I'm gonna go ahead, there's 4 little pieces left, so we'll go ahead and finish out at least Diamond here with his vitals, because I know about you guys, vitals are kind of one of the first things I wanna know. So vital signs, you're good, baby. Do you need to get ready for your Zoom meeting? Go.
No.
Okay.
I saw like 30 minutes.
122/65. So for Diamond, our vital signs are 99.1, 122/65, pulse of 65, 89% on 30% trach mask, and respiratory rate of 24. Okay, go. Bye. Let the dogs in.
Okay, have fun with Benny.
Thank you. Okay. So now, who do you want to see? Okay, now I'm going to try something else because, you know, it wouldn't be fun if I didn't try new things. I'm going to launch a poll and see if it shows for you guys. Can you see the poll? Yes. So which patient is your priority?
Erin,
Yeah.
what's the, okay, so I don't know about cards, but I mean, I know heart and diamond, but what's the one that, the other one that doesn't look like a clover?
Okay, that's spade.
Okay.
Yep. Think of it like a spade. If you've ever done gardening, it can kind of look like a garden spade.
Okay.
All right, so we've got, I think heart's kind of coming in the win here. Can you guys see the results of the poll?
Mm-mm.
No? That's crazy. Okay. Couple of other people, we're waiting for responses. Give it another little bit here. Okay, so it looks like Hart is his Hart's kind of pulling in the lead here. What makes you guys want to go see Hart?
Karma, no.
What makes you want to go see Hart? Because I've seen you guys.
Get down.
I want to go see Hart because I feel like Hart's crashing
Okay.
and we need to get her either into dialysis or blood transfusion. Something.
Yeah. Okay.
With-
Why is her hemoglobin low? Why do you think her hemoglobin's low?
Just have back surgery.
Huh?
Did she just have back surgery?
Nope. Because they wouldn't have done surgery on her if she was 8, 9.
Does that mean she's bleeding?
She could be bleeding. Does the
But
symptoms?
why does she have crackles?
Oh, why does she have crackles?
So do we know so she has, is it bilateral? Or we didn't say. Oh, and she's got the 3+ edema.
Yeah.
Things
So-
are not good.
Right.
The
she's
blood's not
good.
pumping.
Okay. Okay. We could have, guys, what 2 systems control volume in our body?
Circulatory.
And kidney.
Right. So how do they impact, right? Because our kidneys can't make blood and our heart doesn't make blood.
Circulatory pushes the blood around.
Okay, it does. It pushes the blood around, but it can't make it. So which one of these systems is going to tell us, hey, we need to make some blood?
Is it your kidneys?
Yeah.
Because of fluid?
Don't they release erythropoietin or
Ooh, yes.
Yeah. So your kidneys release erythropoietin, which is a hormone that stimulates to your bone marrow that says, hey, I need to make blood. Well, she's got a couple reasons why she's not making blood, right? Her kidneys aren't working, or the kidney that she got, like her kidneys are dead. So her kidneys are gone. They're not working at all. So she got a transplant. So that kidney then has been taking over the work. Who knows if this surgery messed up her kidney or not? Okay. But she also is on what kind of medication? What do all those meds do?
But they depress immune
Right.
response.
Right. We've got a lot of immunosuppressants. Guys, our immunity is our blood. It's in, it's in that blood system. So when we're talking about these patients, a lot of times they got double whammies because they got other things going on, but we're also suppressing their immune system so that their body doesn't attack their kidneys. Okay. There's some really good discussion board posts that I saw about rejection. And I also posted a podcast for you guys to listen to. I can tell if people haven't listened to it because there's a really funny start. So I'll know if you guys, you'll be like, oh yeah, that's great. So,
Hey, Erin.
what?
Erin, Rima is waiting to be accepted into the meeting.
She should be in. I thought I put her in.
And thank you, Christine. Amber sent
Oh.
that one. Yeah.
Okay.
Yeah, she's the A. So there you
Okay.
go. But thanks for letting me
Thanks.
know because I want to make sure everybody's getting in that wants to be. So, but yeah, so when we're talking about all these medications that we're giving people, for anti-rejection, let's talk about what's their biggest side effect or issue that we're going to be worried about.
Fluid retention.
Well, for her specifically, it's fluid, but for these patients overall that have immune issues, what is one of the biggest complications that will kill them? Keep it simple.
Infection.
Right, infection. So, we're suppressing their immune system, especially for her, because we're suppressing her immune system. Her immune system necessarily wasn't overactive to begin with. So when you guys are thinking about immunity, and when you're thinking and answering test questions, and when you're thinking about your patient, think about Goldilocks and the three bears, right? Too little, too big, too much, just right. But where is their just right? Where do they need to be shifted on that spectrum? Because if you have somebody with a kidney transplant and you put them higher up on that spectrum with more immunity, that's going to kill that kidney faster. Okay, so make sure that you're paying attention to that kind of stuff. Like, where on that spectrum do I want them? But then what do I have to do to keep them safe where they are on the spectrum? Okay, so yeah, she's definitely Heather Hart is having a hard day. Okay, say that 5 times fast. But she's definitely, we got low hemoglobin. We got something's happening with her kidney, whether it be surgery caused too much shock to it, or it is that one, her body's finally attacked it. Maybe she had to be off a lot of her medications first. Okay, so that could be an issue. And so then her immune system came up and got it. What kind of information do you want to know about Heather Hart that you don't have?
How long ago was the transplant?
Right. Yeah. If this is an acute reaction or a chronic, okay, how long has she had it? If she had this kidney for 10 years and it's been fine this entire time, and then when she has back surgery, it's not fine anymore, we don't know that. But we know that she's had one, so we know we're concerned about it. Anything else you would want to know about Heather Hart?
I'm curious how old she is.
Oh, okay. Which one is she? Hart. She is 48 years old and a full code. Okay. So let's move down to Diamond. What is ALS? Because I know it's one we haven't covered, but it's one that's really important. And you guys probably have seen if you went to Madonna Vet Unit. Usually there's one on there. Amy, are there any that were on there this time? ALS patients? No? Okay. They probably all died off at this point in time, but usually it seems like when we go, there's always at least one or two.
Isn't that like the wasting, like the Lou Gehrig's or whatever?
Yeah. Yeah. So ALS is the where the immune system gets fired up and it starts attacking. So with MS, it attacks the myelin sheath. With ALS, it actually attacks like the nerve.
Yeah.
What I understand about it. And so it starts from the outside. So it starts, I can't get in my screen here. It starts from the outside, like the fingers, and it works its way in. It starts from the toes and it works its way up. Okay. Guillain-Barré is another one that's really similar, but Guillain-Barré goes away. Okay. Guillain-Barré is the one that's usually triggered like by a flu shot, or West Nile can trigger it. So there's different things that can trigger Guillain-Barré that we know of. It can happen just on its own. But Guillain-Barré goes,
when I used to work at Madonna, there was a guy who had that from West Nile, and like he completely like stopped walking and everything.
Yeah, because it works its way up and then it goes back down. So a point it gets up to the lungs. Again, you're worrying about what it's getting. So it's thinking about it's blocking those nerve receptors. So we have to treat what it's blocking. Okay, we have to maintain life support. ALS is very similar, but ALS doesn't go away. ALS just continually goes. If anybody knows Stephen Hawking, he had ALS. Okay, where he was talking on the in the wheelchair and stuff, that was ALS. So he got it like in his, he was in grad school, I think. So he was like in his 20s. There's a movie about it. I still haven't watched it. I don't want to cry.
The thing is, though, is their mind still stays intact, right?
Yes.
Yes, because we had one at Tabitha, and he used to be like an avid marathon runner, and he was literally wasting to like skin stretched over bone.
Yes.
But he was like still fully, it was really sad.
Oh, ALS to me would be like the worst way to die, because
agree.
Yeah, I mean, so
So why do they do that ice bucket challenge, Erin?
The Ice Bucket Challenge was getting people, and I can actually show you guys a video of where that got started. It's really cool. It's started by a guy named Pete Frates, and he was a baseball player, like college baseball player, and he started it because they need more money for fundraising. And so he was raising awareness and money, and it raised a whole lot of money for them. And they've actually had a lot of really good results. They're finding things to help with it. And so like stem cell transplants are something that they're doing now for it. And they're finding really good things to help rebuild the nerves and stuff. So really, really cool. But let's talk about Donald Diamond. What more information do you want to know on him? Okay. We know he's got ALS. Okay. Is ALS a survivable disease?
No.
No.
It's not. Okay. They're gonna be on a vent at some point in time because it's slowly going to work its way up until basically it gets everything. Okay. So eventually ALS, it's the immune system overreacting and attacking all your nerves. That's simply what it is. So all the treatments for it are going to be things that we want, you know, again, steroids, you know, he's on prednisone all the time. There are going to be a lot of those. They might do like a methotrexate. When you guys start seeing some of the medications, a lot of the immune system ones, they start doing.
Isn't that a chemo med?
Yeah, they'll start doing chemo meds because what are they trying to kill?
The cells.
Okay, yeah, they're trying to kill the cells and the antibodies that your body's creating. Because you have to remember, our body has memory, our cells have memory, so that we don't get the same cold all fall. You know, you give it to your kid, gives it to you, and then your kid, you know, you don't give it back to your kid. You don't give them the same cold back. They get a different cold from someone else. Okay, our body has to build up those antibodies.
HIV medication
for the rememberers.
Here, just a sec, Misty. Go ahead, Jen.
Is that why people take medicine for HIV so it's not replicating those cells?
Yeah. So again, it's breaking down that kind of stuff. Misty, what were you gonna say?
I was just thinking, I remember hearing something about the rememberers and B cells or something.
Yeah. Your B cells are your memory cells. They're your antibody makers. Okay, your T cells are your attackers. Yes. The B cells are the antibody makers. And
Yeah.
So things.
You said like if we wanted to know anything else about him, and I think since he's a full code, I want to know like his family situation and like has anybody talked to him or like anything like that.
Yeah, there's definitely some family dynamics going on, right? Because the family, he's in a wheelchair, guys. He's not going and getting sips of water by himself, right? I have had patients that do that. They go for a walk and then they come back and they have all sorts of problems. And you're like, what'd you drink? Okay. But he's not. He's in a wheelchair. He only has really gross motor movement. He's already got a trait.
Hospice.
Huh?
Hospice.
Well, so is that who? So what the idea of this exercise is? You need to call the doctor, and what are you wanting to get from them? So Jen's bringing up hospice. You want to get a hospice consult?
Yeah.
I
Maybe
sure would.
ask them why they're full code,
Okay.
like information on that.
Yeah, might need some ed on full code status. Like, hey, do you know what that means? Do you go to hospice that we can you can have all the drinks of water you want? Okay, you can have drinks of beer if you want. I don't care. Like, but until then, you are a strict NPO. Okay, so that's something. Yeah, talking to them about quality versus quantity. All right, what quality of life? Again, if you've got that farmer or that rancher who has had steak for every meal of their entire life, and now now they can't have steak or they have to puree it, that's just even not an option for them. And that is like totally taking away their quality. So yeah, for him, we want a hospice consult. I want some quality versus quantity stuff, conversations. Because like Misty said, Donald's brain is fully intact. He is fully present. Okay, so thinking about what does that put him at risk for? Like what?
Depression.
Oh yeah. Okay. Like full on, full blown depression, because he is gonna struggle with losing
Sharp
that.
mind, weak body.
Yeah, strong mind, weak body, and this is not something you can think yourself through, right? Okay, so we've talked about heart, we've talked about that her hemoglobin, we've talked about that maybe she needs to go to dialysis. Okay, maybe we need to get some Lasix ordered to see if that's, maybe do a little Lasix fluid challenge. Okay, what about Spade? What about Spade are you thinking?
I'm concerned about her elimination.
Okay. So we're concerned about that decreased urinary output. Anybody run the numbers for her hemoglobin and hematocrit? Hemoglobin times 3 should equal what?
That should equal the hematocrit, but it's way higher.
Yeah. So what does an elevated hematocrit tell us?
Dehydration.
Yeah. So we talked about our urine output was 80 mLs over 12 hours. What do we usually want your urine to be?
More than that in an hour, or
Right.
less, 50, or I don't know.
Usually want 30 mLs an hour. That's your kidneys working. If you're doing 30 mLs an hour, but if you're doing 80 over 12, that's not even close. Okay, so something's wrong. And when you're listening to her, like, so we've got huge dehydration issues, which would also make sense because she's got her potassium and sodium are both elevated because they're super concentrated in her blood. Okay, so all of that tells us that she's dehydrated. But why is she dehydrated? See, this is where the nursing piece comes in, right? That's all the science stuff. Like, we know the nursing piece, that caring piece, that listening piece. Why is she dehydrated?
Well, why does she have crackles?
Okay.
Throughout.
So we got some sort of crackles going on.
But you said she doesn't have any edema?
Nope. Because what doesn't she want to do?
She doesn't want to drink.
She doesn't want to drink.
Why doesn't she want to drink?
She doesn't find
Because
pleasure.
it makes her cough.
Soaking.
Because
it makes her cough. So what is she doing?
Not drinking.
She's
Doing
not
it
drinking, so she's not voiding.
Okay. What's the coughing, guys? Why do we cough when we drink?
She's aspirating on it, probably.
Yeah. She's aspirating. Okay. She's aspirating on the fluid, and so she doesn't want to drink because it's making her uncomfortable. Like, it makes her cough all the time, and then it makes her just feel yucky, so she doesn't want to drink. Right? That's the pieces we put together as nurses. We have to listen because they will tell us what's going on. We just have to listen to it. All right. So why is she having aspiration?
Is it she's losing like the muscle strength for that, like for her small legs?
Yeah, absolutely. With MS, she's slowly losing that ability. Remember, if you watch the video, right, she has that relapsing, remitting MS, and so mute some of you guys. If you want to talk, make sure to press the space bar. We'll help you. But so yeah, she's aspirating. She's losing the ability to swallow. So who do you want to why do you want to call the doctor for her?
She needs PT, OT, and speech therapy.
Speech. Right? You need to get speech therapy in because, again, hopefully she'll get her swallow back after the flare-up is kind of subsided and gone. But right now we need speech therapy to help her regain some of that muscle strength, regain some of that ability, regain that nerve function while she's going through it. Because we want, like, the problems that are going to happen if she doesn't drink, right? Dehydration. I mean, that's not a killer potassium, but it's high. That 5.1 is a high potassium. That sodium's 148. That's a little high. Those cause problems, right? So we're going to start seeing brain swelling. We're going to start seeing a lot of other issues happening that her body can't heal from because we're not taking care of the issue. She's that way. Okay. Okay, let's talk about Connor Club with the Crohn's. What are we worried about with him?
His colostomy.
Yeah. Something's going on with this colostomy, right? Because what should it be?
What'd you say?
What should an ostomy look like?
Pink, moist, beefy.
Yeah. So we should have, when we're having ostomy, that stoma, it shouldn't be protruding. Like if you've ever seen a sea cucumber, if you haven't, Google it. They're kind of funky, weird looking, but they're slimy things that look like they're like sticking out. So protruding ones I always think kind of look like sea cucumbers, not spiky though. Dusky. Anytime anything's dusky, that's just bad. Okay, it means it's not getting blood flow. Dusky is bad. I can't think of a time when I've assessed someone and found something that was dusky and was like, oh, that's a good sign. You know, unless it was black before and we're now at dusky, then maybe it's improving. So, but yeah, and he has a lot coming out. What else do you want to know about him? What else do you want to know about him?
When did he get the?
What color is he draining?
Okay, the color, so color, like assessment of the drainage. So it's really thin, liquidy, you know, colors, like, yeah, like I want to know what color we've got going on. I want to know what's going on. What'd you say, Jen? Because it was good.
I said when he got it, like when did he get it?
Like how long? So this is a revision surgery, right? So they've done it multiple times. So kind of what I want to know is how much bowel have we lost? Like how much bowel have they continued to take out from him? Because then we're going to start seeing what kinds of issues.
Oh, that's like our guy at St. E.
Yeah. What kind of issues?
Nutrition.
Nutrition. Okay. So we're going to potentially have some huge nutrition in him. Okay. So what kind of order might we want to call and get? What do you think?
TPN?
We might want TPN, okay? But we probably want like a dietary, we want a dietitian to come see him and evaluate him. That might be something. Also, our stoma looks like junk and the skin around it is all pink and red. What are we gonna, who else are we gonna wanna make sure we get in here to consult on him?
Wound
and ostomy. Yeah, so we're gonna do, when we call that doctor, we're gonna be like, hey, he's got a ton of output. Maybe I'd want a weight. I'd want to see if we're declining in weight, you know, or maybe if his labs were real low, which I mean, sodium's 132, potassium's 3.4. So he's probably losing a lot of electrolytes. So we probably want to do, make sure we're watching those electrolytes in there. Okay, and watching that nutrition. So definitely when we call the doctor for this one, we're gonna say, hey, yeah, his ostomy's not looking, or his stoma's not looking real great. Can we have Wound come and look at it? Maybe if you're calling the surgeon, you want them to come look at it. Okay, because if they did it, they know what it looks like. They may be like, oh yeah, that looks great. It was fine. Okay, looks way better than it did the other day, which is what happened when we did our guy at St. E's. I remember when Rhonda was like, we were all looking at it and like, this looks red and horrible and swollen and irritated. And she's like, oh my God, it was black before, so it looks so much better now. And I'm like, okay. So, but dietitian, and then our wound ostomy. Okay. So we know what we're calling the doctor about. We know the orders we want. Who are we calling the doctor first? So we have 4 doctors to call. Which doctor are we calling first? What do you think?
The heart.
The heart?
Oh, no, I take that back.
Okay.
The diamond. Sorry.
Diamond? Donald Diamond?
Mhm.
Maybe Colin, especially because he's got full code. So.
And he needs that, yeah, hospice consult.
Right, and his O2 set, I don't know if you guys remember this piece of it, but his O2 was dropping and he was already on trach mask for 30%, so maybe we need to get his oxygen up a little bit more. Okay, who are we gonna maybe call? Did anybody put somebody else different? Who would you call the doctor on first?
I'm just having a hard time prioritizing.
Okay.
Just because I think like the 3 are very like important. Those Heart, Club, and Diamond.
They all are important.
Yeah, but I mean they're all important. But I just like with top priority. I don't know, because like when we were in that group discussion, Tanisha made a good point, like because she got that transplant, like she can't just get another kidney. So
Yeah.
like what priority would I put her on, because I know that it's rejecting.
Right.
So would I put her like, yeah, I know that, but because I know that and I know how to like go about my day with that, I should put someone else above her and treat them. Is that what I should do?
Well, I'm not saying, guys, there's no right or wrong answer here.
Yeah.
It's not, this is thinking.
Okay.
Thinking doesn't make it right or wrong. Thinking is a process. So maybe you call the doctor for her first because she's more likely to survive than he is.
Yeah.
I mean, right now, you guys all gave me crap when I said we have 1 ventilator who gets the vent, and now we're in that situation, right?
Yeah.
So
Here's the thing though too, Erin, like if we call the doctor on the diamond guy, because I mean he's still fully with it, like he still has his brain function and stuff like that. So if we hurry up and call on him, then we can get him out the way.
Okay.
And then we can focus more on the heart patient who's a full code that needs help immediately. You know what I mean?
Right. So that's totally a plausible thing. Did I talk about, I don't know if I gave Diamond's age. I don't remember.
You said he was 50 something, right?
Yeah, he's 52. He's 52 and Heart is 48. So they're about the same age. So age doesn't, because does age play a role sometimes?
Yeah.
Yeah.
You know, when you're making choices, like if he was 78 and she's 38, that might change how you prioritize. And that sounds really crass and cold and awful, but guys, that's just reality of healthcare. Okay. So, yeah, I mean, and you could even be like, well, I can do a wound consult. I don't need to call the doctor for that. That's within my scope to do. So maybe I just call the wound consult quick because it's the nurse upstairs and I say, hey, when you get in, come check his ostomy, you know? So it's also understanding the processes that you have at your facilities, how that might change you. Maybe if you work at Tabitha, you have hospice people there, and maybe you just have them come in, like kind of on the down low, and just, hey, you're seeing room 518. Can you go step into 524 and just talk to him a little bit and see? Because I'm going to try and call the doctor and get a hospice consult today. You know, so that they've got the heads up. You know, with her, I'm probably making her NPO and just saying we're not eating or drinking anything, and because she's aspirating, and I'm maybe doing a bedside swallow study and then calling the doctor and getting that done. Okay, so there's things that are within our scope as well to do that we have to understand. All right, so these were 4 immune issue patients, right? But immunity is just the inside piece that's going on. It's all the outside stuff that we have to be able to deal with too. And patients rarely come to us with one issue and one disease process. They have pieces together. And so it causes lots of complications and stuff going on. So we have to be able to really understand that. Okay, so hopefully this kind of helps you review some of the patients that you guys have not only seen in clinical, but also seen as you've gone through looking at immunity and looking at the immune process and answering each other's discussions and stuff. All right, so I'm gonna take a, oh nope, I got my phone here. I was gonna take a picture of this and I can post it up on the Canvas page in the lab section, and then if we'll just kind of do the last 30 minutes here as a Q&A for you guys to ask questions and stuff about what's going on. I might have to go behind the camera here. There you go. Okay, I'm going to erase the board because otherwise we're not going to be able to answer a lot of questions.
Hey, Erin.
Yeah.
I'm going to leave so I can get ready for my Zoom.
Okay, go for it. Have fun.
Bye.
Happy holistic.
So Erin, for you, what in your priority, what would have you chose? What would be your order? Like you personally?
I'm probably gonna go see Heart first because we need to get her transferred out. Like the other ones are all gonna stay. So just thinking about who needs to leave, like, because if she's getting dialysis, she probably needs to go and get like a dialysis cath put in. And she was gonna continue to decline. Like the others are, you know, even though like you have the one with the aspiration, she's gonna aspirate, but we can keep her NPO and keep her from aspirating. That stoma is not gonna kill him. It's just we gotta fix it. And then the hospice one, like I'm probably like, hey, hospice consult, or I'm gonna go in and get the temperature of the room, feel out that family, be like, hey, what do you guys know? You know, or gauge where they are. But yeah, so she needs to get transferred. So I'm probably getting, especially if I'm in a rehab facility, I can't do anything to fix her there. So the other ones I could kind of at least hold on to. So, but that comes with knowledge of different facilities and what we have at them, you know? So that's another piece of it, is knowing our policies and procedures and all that fun stuff. So, all right. What kind of questions do you guys have about immunity? Does thinking about immunity, no, that marker doesn't show as well. Okay, does thinking about immunity on a spectrum help?
I did, where with like the too little and the sepsis versus the too much and the anaphylaxis.
Right.
And kind of the balance with the homeostasis. I was just, well, no, I was looking at the autoimmune versus immunodeficient. So okay. Yeah, I'm good with
but
it.
That's, no, but that's good. That's a good place. So that's too much. Too many cells, too many fighters, too many antibodies, right? It's too much. And this is too little. Okay, and it's thinking about, so think about those 4 patients that we just had. Where are they on the spectrum? So we'll go 1, 2, 3, 4, 5. Okay. Where would you put? Now I've got to get my cheat sheet because I have it. Okay. Where would you put Sally Spade? Where was she on this spectrum? So kind of starting down here with too little, we got 1, 2, 3, 4, 5. Where was Sally Spade? She's the one with MS.
MS isn't that? Oh, I don't recall if that's autoimmune. So wouldn't she be down by like a 4 or 5?
Yeah. Yep. So probably there, right? Because she's kind of on that spectrum. So she's got too many white cells, or her white cells or antibodies, they're attacking her, right? They're attacking that sheath. So that's the problem. Okay. Where would you put the what was she? Heather Hart. She was the one with the kidney transplant.
So she could have potentially the like rejection.
Okay.
So I would probably put her with, she's immunodeficient. So I would probably put her like at the 1 or the 2.
Okay, so here's the thing though. No, you're thinking right. That's where we want her to be, right? We want her to be on that immunodeficient side so that her body doesn't attack itself. So we want her to be about here, right? But in reality, if her body's attacking itself,
she's probably at a 3. Okay.
This is where our goal is, right? Our goal is to keep her down there so that she doesn't attack herself. We want to keep her on that too, just a little bit too. I don't want her way down here, because if she gets an infection, well, one of the first things that gets hit when you get an infection is your kidneys, because your kidneys can't filter it out. So we don't want her down here. We want her in that just right spot for her.
So Erin?
Yeah.
Would someone with chemotherapy be on the like number 1?
Yeah, could be.
Okay, because
yeah, absolutely. So yeah, when we get people that are neutropenic, right? Remember when we talked about neutropenic precautions or neutropenic? They may be in the 0s.
Okay.
Okay. And all of that is because what we're doing to them.
Killing their cell.
Yep, that chemo, radiation, all that. So we usually want them, so we want them kind of here, right? This will be our chemo friend. We want them down there because we want to kill the bad cells. Well, we know we're going to kill the good cells too. Okay, so that's why we think of immunity on that spectrum of, we want them down here because we want to kill the stuff. Because if they're up here, then they're just going to keep making more cancer cells. Okay, but we don't want them way down here because that's going to cause huge risks for. So when you're thinking about that infection prevention, guys, it doesn't matter why they're on that side. The infection prevention is the same, okay? You'll get people who we've given a ton of immunosuppressant drugs to, and they can't be in the garden, right? They can't be working in the mold and the moist and all that fungus and stuff like that, because it'll grow inside them, all right? Really gross if you ever get the chance to see somebody with mold in their sinuses, really gross. So, okay, so who else do we have? Where was our ALS person? So our Donald Diamond, where would he have been? Okay, up at the 5?
Yeah.
Yeah. Probably up at that 5 area. He had way too much immune system. It's attacking the nerves. He's losing that ability. And then all the complications that come off of that, right? So the immune system, like, in a way, it's sort of like cancer, where it's the same idea, right? It's the same thing that's trying to happen. Go away. It's the same, it's about the cells and what they're doing. You just have to think about the organ that it's working with. You know, when we talk about blockage, it's that same thing. It's the basic idea of it's blocking something, but I have to understand the organ and the anatomy of what's going on so I can understand what I have to do about it. Because what you do for him is going to be very different than what you do for Hart. But it's all about balancing the immunity for them, making it individual. Okay? So for Donald Hart, what did we need to do? What kind of meds, what types of meds would you really want that patient on?
For Donald Diamond?
Yeah.
I have to look
Probably
up-
anti-inflammatories.
Yeah. I think I saw like.
Biotic.
We have a lot of. Okay, gonna have a lot of immunosuppressants because our goal, remember, where is our goal for him? Our goal is to get him back to the, down there. I can't read it. Okay, there you go. To get him down there as long as possible. Okay, that's our goal. We want to get him down there as long as possible because we know the disease process. It's not, we're not going to change that disease process. This is something like he's going to die. Honestly, with ALS, I mean, you're looking, I think, 2 to 5 years from time of diagnosis to death. It's 2 to 5 years. It's really short. So what kinds of things do you want to talk to Donald Diamond about before we can't?
His
Code
pretty
status.
Yeah.
his code status and like DNR, DNI, or is he just meted? Like, what his wishes are.
Right. I want to know his wishes. I want to know medical stuff. I want to know where he's at. I want to know what part he is, at what point is he actually understanding? You know, like, does he even understand what's really going on? Because this is a complex disease. Okay. This is a pretty complex disease. So does he even understand what it means? Right, I know Pete Brady's video.
Or if he's like scared of death, get the chaplain in there if he has faith.
Yeah, see if there's a faith issue, you know. But if he's like to the point where we're discussing trach, peg, you know, trach, peg, Madonna, is where are we at? Okay, so Pete Brady, right? Stuff that I'll post in your guys' lab section. What else do we have? So Connor, where's Connor? Connor Club with Crohn's. Ugh. Why did I do that to myself? Connor Club with Crohn's. Where is he on a spectrum?
So Erin, I got a question.
Yeah.
You said with ALS it's about 3 years.
2 to 5, yeah.
Okay, so didn't Stephen Hawking live for more than that?
He lived for a really long time. He had a specific subset of ALS and he had the financial resources.
Okay.
So yeah, and he created, like if you think about where you are right now, okay, even I'll think about myself. If I got ALS right now, would my family be able, first of all, would I be able to live in my house that I'm in? Would my family be able to support me to that level? And I don't have the financial resources for that. He was a brilliant physicist, so people helped him a lot. But you do get people, so that's, you know, when you start looking at just health disparities and financial income and insurance and all that kind of stuff, I mean, most of these people are getting put on disability and stuff, so, but, you know, quality versus quantity. And do you want to live that way? Yeah, so it's definitely having conversations, and some people do. Some people are like, keep me alive at all costs. And you do, that's what you do. But I need to make sure they understand the disease process so that they can make that choice, not during an emotional time when they're panicking and having a hard time breathing. But we're talking about, so real quick, any other questions about ALS? I'll post a video about it too. I think I have a good information one. But so Connor Club, where's he? I see Emily
I think
talking.
Connor, there.
Go for it, Christine.
I think Connor now is moving more back towards the middle.
Okay.
Probably at like a 3, going towards a 2.
Right.
Or maybe, I mean, just because they had to take away the attacked tissue.
Right.
And so, I mean,
yeah,
I'm not sure. Well, and he's on the immune suppressors as well, that Remicade.
Right. I'd probably put him kind of in between that 4. Where would we want Connor? Maybe just on this side of the 3. You know, this might be our goal for him.
Right.
So he's hopefully getting back to that spot. And a lot of these meds, guys, you know, if you noticed, a lot of them were, you know, every 28 days, every 4 weeks, every 3 weeks, every 21 days, stuff like that. So there's a lot of things. Like when I did Tysabri infusions, it was, I think those ones were every 20 some days and, you know, 28. And I mean, it was right on the money. Like if we had to adjust that time, if it fell on a weekend, if it fell, it was like that day. Like if we had to delay it, they got real persnickety because they're still doing research on a lot of these drugs. So they need to know. So like when you're talking about like hour windows, when I was doing chemo, one of the biggest things that the doctors got really frustrated with is we did paper charting. So we would, you would have a med that would be due at like 0800, right? And say, or like 12, right? Well, we as nurses know we have an hour before, hour after to give a med. Well, because so many of our patients were on protocols and research, we had a lot of struggles because once we went to computer charting, we would chart that hour, you know, we would just scan it and give it in real time. But for years, doctors were doing research based on us just crossing it out and putting our initials by it and not putting the actual time. So they were doing research off drugs that were given in a 2-hour window. And they didn't realize that until we went to digital, until we went to electronic ERs. You know, it was just like, oh. So they got real, like they were like, all our research is based off this. Because, you know, we would cross it off and put 0737. And even if we did, the doctors aren't going to come up and scan that paper. You know, that was just a paper mark. So, but so a lot of the research, when they do it, is very time specific. So that we get the ideas of it's a control. So, but yeah, we want him back to probably here. We want him a little on that immunosuppressed side, but not, it's Crohn's disease. And it depends. If that's his 3rd flare up, you know, and 3rd resection in a year, then maybe we want him further down here. Okay, so there's a lot of putting the pieces together. Immune diseases are very much individual and unique to the person that has them. And so we have to understand what they have and how to work with it. Okay, what other kinds of questions do you guys have?
Is there going to be a Quizlet for this one?
Yes. My goal is to get it to you by Friday.
Okay. And then I watched I had a quick question. Okay. I recall the meds to be that TAC or that Prograf.
Yeah.
And then I know there was prednisone and Cellcept, but I feel like I'm missing one.
I have to.
Cellcept, prednisone, and the Prograf. I'll have to go back and look at it, but I just didn't know if you knew.
For who?
I think it's just. Are you just watching for the video?
For the video and like the podcast, I was just like trying to take down like the.
So like
the trough is the TAC.
Okay.
Right.
So TAC is the one, yep, that we draw a trough on. So, and you'll, like, those are things that are specific orders. It's just being aware that some of these medications have therapeutic levels. When I know when I asked the INR question, guys, there is a therapeutic level for INR. Same kind of thing. Coagulation. I want them on a certain spectrum of coagulation. I've got that level is going to have to get adjusted depending on the disease process. So our TAC levels get adjusted depending on the disease process and where the doctor orders them to be. So So that's good for us to understand that we may have to draw those. Okay.
Real quick, Misty,
Yeah.
do you are you talking about Theory on the Go, like the podcast?
I can't remember if it was the video that I watched. No, actually, I think it was Theory on the Go now that maybe I think about it.
It's cyclosporin, I think you're talking about.
Okay.
Okay. Thank you so much, Christine. I appreciate
You're welcome.
I appreciate that.
Of course.
Yeah, I'm trying to push out a little bit more meds because I know I'm really weak at meds. And so I'm trying to push them out to make us all stronger and better at them. But I'll admit, meds are not my forte. I like the bigger picture too much. So, okay. So yeah, so you've got the meds. Remember though that some of the meds, when you look them up, sometimes they can kind of be in they'll say they're an anti-neoplastic drug, and it's about the range that we give. So for autoimmune, we're gonna give little doses of it versus that is like continuous, versus as chemo, we're giving it like a bomb. So we're giving it, it's like a firecracker versus dynamite, okay? And so when we're giving it to somebody to maintain them down more in this range, we're going to give them little doses continuously, you know, just like little oral doses. But when we're giving it to for cancer, we want to get those, we want to attack all of those cells at one time. So you'll see a lot like methotrexate. Jen said, yeah, that's a chemo drug. It is. But we can give it for this too, because again, you're trying to kill those same cells. You're trying to kill the antibodies. Something really cool that we can do for autoimmune disorders is you'll hear about plasmapheresis, which is basically dialysis for the blood.
Mm-hmm.
We pull it out, we get out all the antibodies that are causing these problems, and then we pump stuff back in. And it's the same thing. It's almost literally the same thing as dialysis, except instead of taking out waste products, we're taking out antibodies and stuff that is causing the autoimmune disorder. So pretty cool.
Why can't they take plasma out of somebody that's already had COVID and use their antibodies to make a vaccine?
That gets into a lot of science that's above my pay grade.
Sorry,
but they are doing blood transfusions from people that have recovered from COVID, and they're transfusing that because they're transfusing the antibodies.
Yeah.
So they are giving people, I just saw that on the news yesterday, which the news I always take with a really big grain of salt because most of the time it's pretty wrong. Again, you've got people that don't know the difference between Tylenol and Advil, writing medical news stories for people to read by people that don't understand Tylenol and Advil. So I always take it with kind of just a, okay.
Kind of like
they are doing it.
The chloroquine and the Z-Pak. It's like there are heart issues that go with, you know, I think it's the chloroquine and stuff like that. So I don't know. I like Dr. Fauci a lot, but I just wish sometimes he would step in and be like, wait a minute. And he doesn't.
What did he say in an interview that he can't tackle Donald Trump during
It's like, what do you want me to do? Go up there and push him out of the way? And it's like, kinda.
Yeah, the misinformation out there. And right now, people are just grasping at straws. I mean, we've had people die because they took chloroquine, and I think they took like a pet version of it or something. I mean,
the fish tank.
Yeah. So I'm just like, again, if we can't get people to understand that 81 milligrams of aspirin is for antiplatelet and anticoagulation, and 325 milligrams of aspirin is for pain and fever, how do we expect them to understand the difference between fishbowl chloroquine and the grade that we take, right? I mean, this is just like, okay, let people who have studied and researched this do that kind of stuff. But what's really cool is they are doing, because perfect timing for that, they want the antibodies. They want what the B cells remember of how to treat it. So they're transfusing, like people don't have low hemoglobin, they're transfusing them a unit of blood to get the antibodies from the people that have survived. So, I mean, they're trying lots of, see, this is where I'm a little worried for you guys going out, because the rule book that we know, like, it's gone. Like, they're trying things that are unprecedented, that are not FDA regulated, that are, you know, I mean, we're wearing cloth masks. I mean, it's an interesting transition to our world right now. So, you know, just make sure you're staying safe, wash your hands. I think we'll probably have a Nebraska shutdown here soon because they're expecting our peak to be April 23rd. So I would anticipate we're going to have a shelter in place shutdown here soon. So, but we'll see. My boyfriend does not agree. He's like, oh, they're going to be fine. Everybody's going to be fine. I'm like, okay. Like, I'm like, UNO shut down everything. Like by Friday. Like, that's really interesting. And SCC is now shutting down everything. So
Yeah.
like right now I can get in the office if I need to, but I don't. So I brought enough supplies home. But so stay, you know, but it is the antibodies that they want. So, but as far as vaccines go, I don't know all the ins and outs, if they'll have to do a live vaccine or not, or if it'll have to do a dead one like flu is and stuff. So
Can I ask one more quick question before we continue?
yeah.
I mean, you know how like the flu, we have to get a different vaccine every year because it changes. Will this be something, do you think, that will obviously reoccur, and will it change, or will it just be like where you get like the pneumonia shot to ward off pneumonia, or you get like a polio shot, or like a varicella?
I mean, like, we've had the coronavirus. It's already here. We've had it. Like, if you ever look at your Lysol bottle, it says it kills coronavirus. So we've had a strand of it here with us. It's just this strand, this COVID-19. So I'm assuming that it's a specific strand is causing us all the problems. So I don't know. I mean, my guess would be this is going to be a yearly thing now. And, you know, now getting our flu, you'll get your flu shot and your COVID shot. That would be my assumption. But if it doesn't happen, it wouldn't surprise me either.
Okay.
So any other questions about immunity? I mean, that fits all with immunity. It's all vaccines and stuff too. So any other questions about the stuff that we're kind of going through? Hi, Jack.
What do the neutrophils do again? I know the eosinophils fight the bacteria, the monocytes are the cleanup crew. What is the neutrophils again? I'm sorry.
So they're the first to fight.
First line defense.
Yep. So your neutrophils are that first to fight. Your eosinophils fight bacteria and parasites, so things with tails. And then your basophils are your asthma.
The histamine releasers.
And I thought your eosinophils, I wonder if the eosinophils do stuff with allergies too, because that's what, like, they always seem high too, but I don't know if that's just because they're all fighting everything. The lymphocytes, they kill the foreign invaders. Your T cells are those ones that your T cells, they're like the Marines. They like to go in and just shoot stuff. Okay. I mean, they like to go in and kill. So, right. And they try and just take it out and not have to worry about it again. But the B cells are like your nerds. Those are your remembers. Those are the ones that are like, I'm going to take a little bit of this, a little bit of that. I'm going to place it together. I'm going to remember how to, you know, think of your B cells as your MacGyvers, right? They're gonna figure out a way so that they remember it, so that you don't get it. Okay, that's why, like, if you get your flu vaccine, but you still get the flu, you got a different strand of it, but it wasn't as bad.
Yeah.
Because your B cells are going, oh, well, this is sort of like what we did. Your B cells are kind of like your conceptual learners, right? They're like, yeah, I can transfer this to here and I can use it to fight this stuff. Your monocytes are your cleanups.
Yeah.
Okay.
Okay.
Good.
Thank you.
Any other questions? Thoughts or concerns? You're allowed a note card for the exam, front and back. It'll be about the size of your phone. If you don't have note cards specific, it just cannot be the size of a sheet of paper. What I'll have you do is I'll have you probably either hold it up to your hand so I can see roughly the size, or hold it up to your screen, because otherwise, you know, things are pretty deceptive on TV if you don't have a measuring tool. So, but otherwise you can have that to help you. I'll get the Quizlet out here, like I said, on Perfect, perfect, Rima. I'll get it out hopefully on Friday, so at least you can study and get going. Make sure you guys are studying in groups, you know, make Zoom meetings together. I think that really helps, especially with something that's kind of this like, well, what if this? Well, what if that? How would my nursing care change if Connor's stoma was black? How would it change? You know, those are those tweaks in there. Okay. Any other thoughts? All right. Well, great job learning today. Hopefully it was kind of fun and a little different. We'll see how it goes on Monday. If you have questions, make sure you email me and we'll go from there. All right.
All right.
I'll see you Monday at 8:45. Try and make sure we're early so that we can get in and get set up and get going. Okay?
Okay.
All right. See you guys.
Bye.
Bye. Thank you.